What if your body has been warning you about kidney disease for months, but you thought it was just tiredness, stress, aging, or not drinking enough water? Your kidneys can lose a large amount of function before obvious symptoms appear. That is why noticing the early signs could be one of the most important things you do for your health. I'm Dr. Sam Waterling, and today I want to help you understand 17 warning signs of kidney disease that you may be able to spot yourself before they become impossible to ignore. Stay with me until the end, because some of the most common signs are also the ones people dismiss most often. Your kidneys are two small organs, but they have a huge job. They filter waste from your blood, help control blood pressure, balance fluids and minerals, support healthy bones, and help your body make red blood cells. When the kidneys are not working properly, waste and extra fluid can build up in the body. The challenge is that kidney disease can develop quietly. Many people do not know there is a problem until it has progressed. These signs do not always mean kidney disease. But if you notice several of them, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney problems, it is important to speak with a qualified healthcare professional and ask about kidney testing. Kidney disease can develop quietly, often without dramatic pain or obvious warning signs in the early stages. This is one of the reasons it can be so dangerous. Many people expect a serious health condition to make them feel immediately unwell, but the kidneys are remarkably adaptable organs. They can continue working even when some function has already been lost. As a result, a person may have kidney damage for months or even years without realizing it. Your kidneys perform essential tasks every single day. They filter waste products from the blood, remove extra fluid through urine, help regulate blood pressure, balance important minerals such as sodium and potassium, support healthy bones, and help the body produce red blood cells. When kidney function begins to decline, these jobs become more difficult. At first, the body may compensate, and symptoms may be subtle enough to overlook. You may simply feel more tired than usual, have less energy during the day, or notice that you are not sleeping as well as you used to. Some people assume that tiredness is caused by stress, work, aging, poor sleep, or a busy lifestyle. While these can certainly play a role, ongoing exhaustion should not always be dismissed. When the kidneys are struggling, waste products can build up in the bloodstream. This can leave you feeling drained, weak, mentally foggy, or unable to focus. Kidney disease can also contribute to anemia, a condition in which there are not enough healthy red blood cells to carry oxygen around the body. This may make everyday activities feel harder than they should. Another reason kidney disease is easy to miss is that its symptoms can look like common problems. Swelling in the feet or ankles may be blamed on standing too long. Waking up often at night to urinate may be blamed on drinking water before bed. Itchy skin may be blamed on dry weather. A poor appetite may be blamed on stress. Foamy urine may be ignored completely, but when several of these changes happen together, they may be important clues that your kidneys need attention. People with high blood pressure, diabetes, heart disease, obesity, or a family history of kidney disease should be especially aware. High blood pressure and diabetes are among the most common causes of kidney damage. High blood sugar can slowly harm the tiny blood vessels inside the kidneys, while high blood pressure can put extra strain on these delicate filtering systems. Over time, this damage can reduce the kidney's ability to clean the blood properly. The good news is that kidney problems can often be detected with simple tests. A blood test can measure how well the kidneys are filtering waste, while a urine test can check for protein or blood that should not be there. These tests can identify changes before severe symptoms develop. Early detection can give you and your healthcare professional the opportunity to manage risk factors, monitor kidney function, and take steps to protect your health. Poor sleep and kidney health can be closely connected, although many people never make that connection. A person may think they are simply stressed, getting older, drinking too much tea or coffee, or spending too much time on their phone at night. But when sleep problems become frequent, persistent, or are combined with other changes in the body, they can sometimes be an important signal that deserves attention. The kidneys play a major role in maintaining the body's internal balance, and when that balance is disrupted, sleep can be affected in several ways. One common problem is waking up repeatedly during the night to urinate. This can interrupt deep sleep and leave you feeling exhausted the next day. As kidney function changes, the kidneys may lose some of their ability to concentrate urine properly. This can lead to producing more urine, particularly at night. You may find yourself waking up 2, 3, or even more times to use the bathroom. While this can also happen because of an enlarged prostate, urinary tract issues, diabetes, certain medications, or drinking fluids late in the evening, it should not be ignored if it is new or becoming more frequent. Kidney problems can also contribute to restless sleep. Some people experience uncomfortable sensations in the legs, muscle cramps, tingling, or an urge to move their legs at night. These symptoms may make it difficult to fall asleep or stay asleep. Changes in mineral levels, including calcium, potassium, phosphorus, and magnesium, can affect the muscles and nerves. When the kidneys are not filtering and balancing these substances effectively, the body may struggle to settle into restful sleep. Itching is another issue that can interfere with sleep. Persistent itchy skin may seem like a small problem, but it can become extremely uncomfortable at night. People may scratch without realizing it, wake up repeatedly, or feel unable to relax. In some cases, kidney dysfunction can lead to changes in minerals and waste products in the blood, which may contribute to dry, irritated, or itchy skin. If you are using moisturizers, changing soaps, and trying other simple solutions, but the itching continues, it may be worth discussing with a healthcare professional. Breathing can also affect sleep quality. When the body retains excess fluid, it may contribute to shortness of breath or make lying flat uncomfortable. Some people may wake up feeling breathless, cough more at night, or need extra pillows to sleep comfortably. These symptoms can have many causes, including heart and lung conditions, but they should be assessed promptly, especially if they are new or worsening. Poor sleep can also make kidney health harder to manage. Lack of quality sleep may increase stress hormones, affect blood pressure, worsen blood sugar control, and increase inflammation in the body. This is particularly important for people with diabetes or high blood pressure, because both conditions can place additional strain on the kidneys. A cycle can develop where kidney problems disturb sleep, and poor sleep makes it more difficult to control the health factors that protect kidney function. Changes in urine are among the most important warning signs to notice because urine can reveal a great deal about how the kidneys and urinary system are functioning. Your kidneys filter your blood all day, removing waste products and extra fluid while keeping important substances, such as proteins and blood cells, where they belong. When the kidneys become damaged, some of these substances may leak into the urine, or the amount, color, smell, and appearance of urine may begin to change. These changes do not always mean kidney disease, but they should never be ignored when they are persistent, unusual, or happening alongside other symptoms. One of the most noticeable changes is foamy or bubbly urine. A few bubbles can be completely normal, especially if urine hits the toilet water quickly. However, urine that repeatedly looks very foamy, thick, or frothy may be a sign that protein is leaking into the urine. Normally, protein stays in the bloodstream because the kidney's filters prevent it from passing through. When these filters are damaged, protein can escape into the urine. This is often called proteinuria, and it can be an early sign of kidney damage, particularly in people with diabetes or high blood pressure. Blood in the urine is another sign that requires attention. Urine may appear pink, red, rusty, tea-colored, or dark brown. Sometimes the amount of blood is so small that it cannot be seen without a urine test, but visible blood should always be checked by a healthcare professional. Blood and urine can be linked to kidney stones, urinary tract infections, bladder conditions, injury, certain medications, or kidney disease. It is not something to diagnose at home, and it should not be dismissed simply because it happens once. The frequency of urination can also change. You may begin waking several times at night to use the bathroom, feel the need to urinate more often during the day, or notice that you are passing unusually small or unusually large amounts of urine. In some cases, damaged kidneys may struggle to concentrate urine properly, causing more frequent urination. In other cases, advanced kidney problems may reduce urine output. A sudden decrease in urine, especially with swelling, shortness of breath, severe weakness, or confusion, can be serious and needs urgent medical attention. Urine color can provide another clue. Pale yellow urine is often normal, while darker yellow may simply mean dehydration. But urine that remains very dark despite drinking fluids, or urine that appears brown, red, orange, cloudy, or unusually strong smelling, should be discussed with a healthcare professional. Cloudy urine can sometimes be related to infection, crystals, or protein. A strong smell can be caused by dehydration, foods, vitamins, infection, or medication. But if it continues with pain, burning, fever, or back discomfort, it should be assessed. Pain or burning during urination can also be important. While this is more commonly associated with a urinary tract infection, repeated infections can sometimes affect the kidneys if not treated properly. Pain in the side, back, or lower abdomen together with fever, chills, nausea, or urinary changes may indicate a kidney infection or stone and should be evaluated promptly. Swelling in the ankles, feet, legs, hands, or face can be one of the more visible signs that the body is holding on to extra fluid. The medical word for this is edema, and it can happen when the kidneys are no longer able to remove enough salt and water from the body. Healthy kidneys carefully balance fluids every day. They decide how much water should stay in the bloodstream and tissues and how much should leave the body through urine. When kidney function is reduced, that balance can be disturbed, allowing fluid to build up where it should not. Many people first notice swelling around the ankles or feet. Shoes may suddenly feel tighter, socks may leave deep marks around the legs, or the feet may look puffy by the end of the day. Some people notice that their rings feel tight, their hands seem swollen in the morning, or their face looks fuller than usual. Puffiness around the eyes, especially after waking up, can be particularly important because it may sometimes be linked to protein leaking into the urine. When the body loses too much protein through the kidneys, fluid can move out of the blood vessels and collect in surrounding tissues. Swelling does not always mean kidney disease. It can also happen after sitting or standing for long periods, during hot weather, after eating salty foods, during pregnancy, because of certain medicines, or due to problems involving the heart, liver, veins, or lymphatic system. However, swelling that is new, persistent, worsening, or appearing with other symptoms should not be treated as a minor inconvenience. It can be a clue that the body is struggling to manage fluid properly. A simple way some people notice fluid retention is by gently pressing a finger into the swollen area near the ankle or shin. If the skin stays indented for several seconds after the finger is removed, this may be called pitting edema. It does not confirm the cause, but it is useful information to share with a healthcare professional. You may also notice rapid changes in body weight over a few days. This can sometimes happen because of fluid buildup rather than body fat. For example, gaining several pounds quickly while also noticing swollen feet or a puffy face may suggest that the body is retaining fluid. Swelling can become more concerning when it is accompanied by shortness of breath, chest discomfort, unusual tiredness, reduced urination, or difficulty lying flat at night. Extra fluid can sometimes affect the lungs and make breathing more difficult. If swelling appears suddenly, is severe, affects only one leg with pain or redness, or occurs with breathing problems, urgent medical care may be needed. People with high blood pressure, diabetes, heart disease, or known kidney problems should pay particular attention to swelling. These conditions can affect the kidneys and circulation, increasing the risk of fluid retention. A healthcare professional may check blood pressure, kidney function, urine protein, heart health, medication use, and salt intake to understand what is causing the swelling. Itchy skin, nausea, poor appetite, and changes in taste may seem like unrelated everyday problems, but together they can sometimes point to changes in kidney function. The kidneys are responsible for removing waste products and helping keep minerals, fluids, and chemicals in balance. When the kidneys are not filtering the blood effectively, waste can build up and the body's internal balance may begin to shift. These changes can affect the skin, stomach, mouth, appetite, energy levels, and overall sense of well-being. Persistent itching is one symptom that people often overlook. They may assume it is caused by dry weather, a new soap, allergies, heat, sweating, or a skin condition. While these are common causes, itching that continues for weeks, becomes more intense at night, or occurs without a visible rash may deserve further attention. In people with reduced kidney function, changes in mineral balance and waste buildup may contribute to dry, irritated, or itchy skin. The itching may affect the back, arms, legs, scalp, or entire body, and it can become frustrating enough to disturb sleep and affect daily comfort. Nausea is another symptom that can develop when waste products are not being removed efficiently. Some people may feel mildly sick in the morning, while others may experience ongoing stomach discomfort, bloating, or a feeling that food does not sit well. In more serious cases, nausea may lead to vomiting. Because nausea can be caused by many conditions, including infections, medications, digestive problems, stress, migraines, and pregnancy, it is important to look at the full picture. If nausea continues without a clear reason and appears alongside tiredness, swelling, urinary changes, or loss of appetite, kidney health should be considered. A reduced appetite can happen gradually. You may notice that you are skipping meals, feeling full after only a few bites, or no longer enjoying foods that you once liked. Some people lose weight without trying because they simply do not feel like eating. This can become a serious problem because the body still needs enough protein, calories, vitamins, and minerals to stay strong. When appetite is poor for a long time, weakness and fatigue can become worse, making it even harder to maintain normal routines. Taste changes can also be surprisingly noticeable. Food may begin to taste metallic, bitter, salty, or simply different. Some people describe a strange taste in the mouth that does not go away even after brushing their teeth or using mouthwash. This can make meals less enjoyable and may contribute to poor appetite. Persistent bad breath may also occur, sometimes with an ammonia-like or metallic smell. Dental problems can certainly cause bad breath, but when it happens with nausea, taste changes, fatigue, or appetite loss, it is worth mentioning to a healthcare professional. These symptoms can affect quality of life in ways that are easy to underestimate. A person may sleep poorly because of itching, eat less because food tastes unpleasant, feel weak because they are not eating enough, and become more tired because their sleep is disturbed. This can create a difficult pattern where several mild symptoms gradually begin to affect everyday life. High blood pressure and diabetes are two of the most important risk factors for kidney damage, and many people do not realize how closely these conditions are connected to kidney health. The kidneys contain millions of tiny filtering units called nephrons. These filters work continuously to remove waste, control fluid levels, and keep important substances in the bloodstream. Over time, high blood pressure and high blood sugar can damage these delicate filters, reducing the kidney's ability to work properly. High blood pressure, also known as hypertension, means that blood is pushing against the walls of the arteries with too much force. When this pressure remains high for months or years, it can damage blood vessels throughout the body, including the very small vessels inside the kidneys. These blood vessels are essential because they deliver blood to the kidney filters. If they become narrowed, stiff, or damaged, the kidneys may not receive enough healthy blood flow. This can gradually reduce their ability to remove waste and extra fluid from the body. The relationship can become a dangerous cycle. High blood pressure can damage the kidneys, but damaged kidneys can also make blood pressure harder to control. When the kidneys struggle to regulate salt and fluid, the body may retain more fluid, which can increase blood pressure further. This creates additional strain on the heart, blood vessels, and kidneys. A person may not feel high blood pressure at all, which is why it is often called a silent condition. Regular blood pressure checks are important, especially if there is a family history of hypertension, heart disease, stroke, or kidney problems. Diabetes can also cause serious kidney damage over time. When blood sugar stays too high, it can harm the tiny blood vessels that act as filters inside the kidneys. At first, the kidneys may begin to leak small amounts of protein into the urine. This is often one of the earliest signs of diabetic kidney damage. As the condition progresses, more protein may appear in the urine and kidney function may gradually decline. Because this process can happen slowly, a person with diabetes may feel completely normal while damage is developing. People with diabetes should have regular kidney checks even if they feel well. These checks often include a blood test to measure kidney filtration and a urine test to look for protein. Detecting protein in the urine early can be extremely valuable because it may allow treatment plans to be adjusted before more serious damage occurs. Managing blood sugar, blood pressure, cholesterol, body weight, and smoking status can all play a role in protecting kidney function. Certain lifestyle habits can also influence both blood pressure and diabetes control. Eating large amounts of salty processed foods can make fluid retention and blood pressure worse. Lack of physical activity can affect blood sugar, weight, circulation, and heart health. Smoking can damage blood vessels and increase the risk of kidney disease. Some over-the-counter pain medicines, especially when used frequently or in high doses, can also place extra stress on the kidneys, particularly in people who already have diabetes. High blood pressure, dehydration, or reduced kidney function. A simple blood test and urine test can help detect kidney problems early, often before serious symptoms appear. This is important because kidney disease may develop slowly and quietly. Many people feel normal in the early stages, even when the kidneys are beginning to lose function. Waiting until swelling, severe tiredness, nausea, breathing problems, or major urinary changes appear can mean that kidney damage has already progressed. Regular testing gives healthcare professionals a chance to identify warning signs early and take action before the condition becomes more serious. One of the most common blood tests used to check kidney function measures a substance called creatinine. Creatinine is a waste product produced by normal muscle activity. Healthy kidneys remove creatinine from the blood and send it out of the body through urine. When the kidneys are not filtering properly, creatinine levels can rise in the blood. Healthcare professionals use this result, along with factors such as age and sex, to estimate how well the kidneys are filtering. This estimate is often called eGFR, which stands for Estimated Glomerular Filtration Rate. A lower eGFR may suggest that the kidneys are not working as efficiently as they should. A urine test is equally important because it can detect problems that may not show up clearly in the blood at first. One of the key things checked in urine is protein, especially a protein called albumin. Normally, albumin stays in the bloodstream because healthy kidney filters prevent it from passing into the urine. If albumin is found in urine, it may be an early sign that the kidney filters are becoming damaged. This can be particularly important for people with diabetes or high blood pressure, because these conditions can gradually harm the kidneys long before obvious symptoms appear. A urine test may also look for blood, signs of infection, glucose, crystals, and other substances that can provide useful clues about kidney and urinary health. Blood in the urine can be linked to infections, stones, kidney disease, bladder conditions, or other causes. Protein in the urine may suggest kidney damage. Glucose in the urine may point to poorly controlled blood sugar. The results do not always give a complete diagnosis on their own, but they can guide healthcare professionals toward the next steps. Testing is especially important for people who have risk factors. This includes people with diabetes, high blood pressure, heart disease, obesity, a family history of kidney disease, or a history of kidney stones. People over the age of 60 may also benefit from regular checks, as kidney function can naturally change with age. Some medicines can affect the kidneys as well, particularly if they are used frequently, combined with dehydration, or taken by someone who already has reduced kidney function. Early testing can make a major difference because kidney damage is often easier to slow down than to reverse. A healthcare professional may recommend managing blood pressure more carefully, improving blood sugar control, reducing salt intake, reviewing medications, treating infections, staying properly hydrated, or monitoring kidney function more regularly. In some cases, additional tests such as ultrasound scans, repeat blood work, or specialist referral may be needed to understand the cause of abnormal results. The message I want you to take away today is simple. Your kidneys work silently every day to protect your body, but kidney disease can also develop silently. That is why paying attention to small changes can be so important. Do not ignore constant tiredness, poor sleep, foamy urine, blood in urine, swelling in your feet or face, ongoing itching, nausea, appetite changes, high blood pressure, or frequent urination. Any one symptom may have a different cause, but when several signs appear together, your body may be telling you that it needs attention. If you have diabetes, high blood pressure, heart disease, a family history of kidney problems, or you are over the age of 60, regular kidney checks can be especially valuable. A simple blood test and urine test may help identify problems early, often before serious damage occurs. Early action can make a real difference. Managing blood pressure, controlling blood sugar, reducing excess salt, staying active, avoiding smoking, and reviewing medicines with a healthcare professional can all support kidney health. Please remember, this information is for education and should not replace personal medical advice. If you notice blood in your urine, severe swelling, trouble breathing, very little urine, severe pain, or sudden worsening symptoms, seek medical care urgently. Take care of your kidneys because they are taking care of you every single day. If you found this video helpful, please like, subscribe, and share it with someone who may need to hear these important warning signs.